My name is Darren Karabensiov, and I am a fourth-year resident in neurology at the Mayo Clinic. I am one of the authors of the article titled Safety of Lumbar Puncture Performed on Dual Antiplatelet Therapy, which will be published in Mayo Clinic Proceedings. In current clinical practice, lumbar punctures are often avoided in patients that are taking aspirin and clopidogrel. The decision is based on concern about potential complications such as epidural hematomas. However, available data about the risks of performing the procedure in this setting is quite limited. The take-home message of our study is that lumbar punctures performed on patients taking aspirin and clopidogrel may not necessarily result in increased complications. To try to identify complications, we performed a retrospective medical record review of outpatient, inpatient, and emergency lumbar punctures at the Mayo Clinic in the past 6 years. 100 patients on dual antiplatelet therapy at the time of the lumbar puncture were identified. In the 3 months after a lumbar puncture was performed, no hospitalizations or imaging studies were required for any reason potentially attributable to the LP. The small size is certainly a limitation, but the number of patients is not insignificant. Given the significant disability which can result from an epidural hematoma, patients or their surrogate decision makers should be carefully counseled prior to consideration of an LP in the setting of dual antiplatelet therapy. While additional studies are certainly necessary, continued review of the clinical practice is very reasonable because withholding antiplatelet agents increases the short-term risk of thromboembolic complications, causes diagnostic delays, and in some cases impedes ultimate diagnostic certainty, particularly when the lumbar puncture is requested emergently.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.